At the psychiatric hospital in western Donetsk, an elderly man stands reciting Pushkin. The shelling has been getting closer. The patients are being told what's happening, but it's difficult for many of them to understand. Inside and up the stairs to the ward, the staff are trying to keep things as normal as they can, but they're frightened too. The doctor shows us a picture of their ward nurse, Irina. She was killed in shelling at home.
At Wednesday, she was at home after work when the place were heavily shelled, and she died. She was killed by a big piece of shell. It went through her chest.
She shows us her office. From next week, she says she will live here full time. It's becoming too dangerous to try to get home. She wants us to film Vera Fyodorovna. She's 92 years old, a retired school teacher. Her neighbours found her lying on the floor at home.
Her name is Vera Fyodorovna Pismenova. She has nephews in Russia. Maybe someone will see that she is alive, that she cannot look after herself. We took her here and we don't know if we can save her or not, but we hope we can.
Next door, 77-year-old Nina Pavlovna. They found her begging near the church. She says the shelling began. I had nowhere to live. I was begging on the street, so they took me here, washed me, changed my clothes, and I'm grateful for that. Outside, another patient paces back and forth. The hospital is running low now on money, food and medication.
The staff here say they haven't been paid for 4 months. The Ukrainian government in Kiev has cut off their salaries and they only have enough medicine until Tuesday.
In another block, the heating has broken, so they're gathered round a wood stove. These are not people who've chosen to live in a rebel-controlled region. They're the vulnerable with nowhere else to go. Across the city to the northeast, a doctor from Médecins Sans Frontières is taking medical supplies to an elderly care home. Their teams are working on both sides of the conflict zone. They're reporting shortages of antibiotics, painkillers and suture kits.
Как у вас дела? Замечательно, очень хорошо, очень хорошо. It's really big problem, these medications, and we're getting different requests from different hospitals. They need support in this, and we are doing our best. Now we support with the war-wounded kids that we have. We support with maternity kits for 100 women. We support with chronic disease kits as well.
Again, here we met elderly pensioners who've lost their homes in the shelling, who are traumatised and confused. This has been going on here for 9 months now. They don't know when it will end. Katie Stallard, Sky News, Donetsk.